now let's talk about some foot conditions that often require surgery. So what are some of those, if we can talk about them?
Well, the most common conditions that require surgery are bunions and hammertoes, which are deformities of the toes. And then there are lots of other conditions that don't necessarily need surgery, such as plantar fasciitis and bone spurs, and I think we're going to touch a little bit upon them later.
Okay, now there is here, Time Magazine and the Institute for Preventative Foot Health have a few things we should all know about foot pain. Number one, pay attention to everyday aches. That's important. Anything from wearing the wrong footwear to high impact exercise can trigger a condition like bunions or worse. Is this true, doctor?
That is true in general. So not every pain you have in your foot is going to lead to a surgical problem, but if you are having a pain that is persistent and consistent and you are ignoring it, that's definitely going to lead to a bigger problem that may end up requiring surgery. So I just tell patients, listen, just pay attention to your feet. If it's something consistent, persistent, we need to check it out.
All right. The Institute for Preventative Care also found that obese people are more than 40% more likely to have a current foot issue. So does that quote, fewer pounds means happier feet, resonate true here?
It definitely does, Olga. That's a great point. And it's important that it's not just obesity that causes a problem, it's any excess in weight. Myself, if I put on a couple extra pounds, my feet tell me about it. So even a couple of pounds here and there relative to your weight can make a big difference. So the lighter you are, the better you will feel. There's absolutely no doubt to that. It's the first thing I tell my patients is with any foot condition, the lighter you are, that's the first treatment option. Now, a lot of my patients complain to me, well, I've got sore feet, I can't exercise. And that's true, and I sympathize with that. But there are many exercise regimes that you can do to, without compounding the foot problem, such as swimming, stationary bicycle, elliptical. And if you get a good personal trainer, they'll be able to work around your foot problems so that you can still lose some weight.